Okay, good evening everyone. My name is Farzana, and tonight I will be informing you about the current access to healthcare in the United States. So, what do we know about healthcare in America? Anybody?
It's complicated.
I agree. The United States healthcare system is unique but very complex. And the United States spends more than any other industrialized country, than we have Australia, New Zealand, Switzerland, we're all the way up here, 8,500. Moreover is that Americans don't go to the doctor very frequently. So that questions, we're spending so much, our people don't go to the doctor, raises an important question for us. Health is everyone's concern, I'm sure you'd all agree. But do we have adequate access to healthcare? So tonight I will be going through these 3 dimensions of access, which are very necessary, including the physician population size, the composition, and geographic distribution, setting up my agenda for tonight as well. So to begin with, the physician population size. The physician population size can be measured in 2 ways. There are absolute counts, which is actually the head count of all the physicians in the country. And from 1970 to 2010, the American Medical Association has found that the total physician size has increased by 98%. By 2011, we had 1,004,635 physicians. That's a wow number. Using these numbers, the American Medical Association has calculated the physician to population ratio. And what this really is, it's a big word, but what it really does is that it compares the total population in terms of physician with the civilian population. So what they found is that from 1970, for every 100,000 of the population, there were only 167 physicians. By 2010, there were 319 physicians. Areas such as New Jersey were enjoying 404 physicians. So gives a good background on access to healthcare across the country in general. But this is not enough. We must examine the composition of this size. Composition can be measured in a number of ways, but practice fields, which is a specific practice of a physician, is necessary. So what the American Medical Association did as well is that they surveyed all the physicians, and what they found is that of the total, 60% of those physicians were practicing in only 10 fields. What they also found is that more than 2/3 of the percentages were specialists, and less than 1/3 were primary care physicians. So anyone knows the difference between a specialist and a primary care physician? Anybody?
You want me to say?
No, I just want to
Okay.
clarify. It's basically just for those of you who might not know, your primary care physician is your first go-to physician. So if there are less than 1/3 primary care physicians, then there is some question in terms of access. What they also found, however, is that certain specialties, main specialties like cardiology, neurology, there were shortages in those fields as well. My interviewee, Philip Prices, who was actively involved in policy making in the New Jersey Department of Human Services, mentions that the lower number of primary care physicians, coupled with a higher demand of patients seeking primary care services, means that there will be longer appointment wait times, and this in itself is a restriction to access. Nevertheless, we must examine the geographic distribution, or the location of these physicians. The American Medical Association has also found that there are substantial regional variations in our doctors. They found that certain counties were having a 50% surplus in doctors, and others were having a 10% deficit. They also found that 55% of our population was located in 10 states. We have California, Florida, New Jersey, Michigan. These are obviously our metropolitan states. However, this indicates to us that those states with rural counties were receiving little or no care at all. In conclusion, while we're seeing that the number of physicians are increasing over time, the composition and the geographic distribution of our physicians must be addressed. Now, government understands that, and I'm sure you're all aware of the Affordable Care Act, which is supposed to be kicking in sometime soon. We're all waiting for that. And the Affordable Care Act has specific regulations to address composition and the geographic distribution of physicians. Can the Affordable Care Act really help us? Sorry for the small numbers, but about $250 million will be allocated towards moving physicians to underserved areas or the rural areas. And 16,000 new physicians will be funded in the next 5 years in terms of primary care. So they're trying to increase that 1/3 that we were talking about earlier. They're trying to increase that number there. To end, my interviewee mentioned that in terms of access to health care, the Affordable Care Act is bittersweet. While formerly uninsured patients may find new opportunities to receive health care services, the physician population is not structured to address the additional demand. Thank you.